podcast. If you're ready to grow, then let's go. This is the Lincoln County Podcast. Hey, yo, Matt, let's start the show.
Thank you to our sponsors, K. Flynn Insurance, elect Bruce Becker for the Lincoln County Fire Board, and the Crafty Midwestern Mommy for their continued support of the Lincoln County Podcast.
Hey guys, welcome to another episode of the Lincoln County Podcast. Again, got another great guest on today, actually 2 guests today, and looking forward to sit down, chatting about everything. And I want to thank you guys for liking, sharing, and subscribing to the podcast, supporting our sponsors, because without them, we wouldn't have this podcast. So I want to get everything kicked off here, let my guests introduce themselves, and we're going to dive right in. How's it going today?
It's great. Good to see you. Thank you so much for inviting us.
Appreciate it.
I am Doug Bouldin. I'm a family nurse practitioner, and I'm the co-owner with Dr. Devin Bell of DB2 Regeneration Clinic in Lake St. Louis.
Yeah, my name is Dr. Devin Bell. Appreciate you having me on here. And yeah, we started DB2 about a year ago, so we're almost at that 1-year anniversary.
Yeah,
that's awesome. That's a really cool place to be in business too. That's like a neat feeling of that 1 year.
Yeah,
and then as the business grows, it's kind of, I don't know, kind of loses it. Like that first year was just so cool for both of my business, and then like as they grow, it's like 5 years, 10 years, But that first year is always a really good benchmark.
Yeah, honeymoon period with it.
Mm-hmm.
Yeah.
Yes. You're getting over that pucker factor where you go, all right, are we going to be able to do this? And now we see that indeed we are, and patients are extremely responsive to what we offer. So
that's awesome. So what all exactly do you guys do there?
So we are a regenerative medicine clinic, and we focus on certain treatments that improve patients' quality of life. We both are family practice. Dr. Bell is a family practice physician. I'm a family nurse practitioner. So we also don't check that knowledge at the door and choose not to use it because we focus so much on regenerative medicine. We also apply those types of treatments and surveillance labs, x-rays, diagnostic studies. We still use that data. We still talk to patients about those things. So, even if someone comes to see us with a degenerated knee, if they have hypertension, we're talking to them about that because that's also a quality of life issue. So,
yeah, one of the big components, Doug and I have worked together for about 8 years now. And, with that family practice background, it really showed us a lot of things in medicine that we didn't like. And we wanted to bring a different form of medicine to patients. And that's really, you hear the term concierge medicine or even direct primary care, and we do a form of that. And we really give the patients that time, the advice that they're looking for, and really build that relationship. So really, truly what we do is we do relationship-driven healthcare. And that can be in the form of managing your medical symptoms. It can also be in the form of helping joint pains, like with regenerative medicine, which is PRP and stem cell. It could be optimizing your hormones. So that's testosterone replacement therapy. That is creams, injectables, pellets. There's a lot of different forms. That's for men and for women. Mm-hmm. So we treat both. And it is amazing how many women that we see in that 35 to 55 range that have just, the traditional system has failed them.
Yes.
They're no longer having babies anymore, so their OB doesn't have a lot to offer. They're not quite menopausal yet, but they're symptomatic. They don't feel themselves. They don't feel right, and they need some help. And so we're there to listen, get some good data, and actually give them options for intervention. So hormone optimization is a big part of what we do. And then, of course, the use of peptides, so in the form of weight loss management. There's not many drugs on the market that work like the new GLP-1s do. It's an amazing transition in healthcare, and how well that is done for patients is just outstanding. So we incorporate that in our protocols, and of course we have chiropractic and rehabilitation as well. Wow. So yeah,
whenever you cover it all.
We do. Yeah. We're really kind of an all-encompassing clinic.
It's an integrated clinic. So
yeah, and see, that's great because so I have never liked traditional doctors. Never liked going to traditional doctors. I've had more arguments with doctors than ever just because I had like a tumor in my ear when I was a kid. I basically only get strep throat or an inflammation in the ear. I actually don't even get like a full ear infection. But I would go, we're going to do that. I'm like, listen, 42, I had this surgery when I was 4. This is what's wrong. I want this eardrop. Can't think of what it's called. This eardrop, it takes care of 2 drops in my ear and I'm good. It's just, that's all I need. Well, that's all I need. Well, we got to check, especially COVID was big. You need a COVID test. No, I don't have COVID. I'm not getting it. I'm good. Like, I don't have that. Because I get, also I carry staph. So if I don't bleach bath after a tattoo, I will end up with staph. No matter how clean the place is, it's just on my skin. A friend of mine, we caught onto it years ago that I just, after a tattoo, I do. So I know what I'm doing. Or if I go, I will research things, Before I went on TRT years ago, I researched the hell out of it, and every doctor was like, that's not what's wrong. I'm like, I'm telling you, when I look it up, that's what's wrong with me. That is exactly why I'm not sleeping. Once it was a whole rough ride with that because I went to a place that wasn't very good. But once I got that, like, I had researched, I knew what I wanted, but they were, well, maybe, have you tried antidepressants? No, I'm not sleeping good. Let's look at the hormone. Like, it was a fight. Yeah. Now it's been a lot of years ago at this point, but I think more people are learning about it. More people are learning about peptides. I think Andrew Huberman and a lot of his content that went out helped a lot of people because he's so smart, but you look at him like, that dude's jacked. I'll listen to him. Like, if he looked like Bill Gates, everybody'd be like, well, all right, man, don't tell me about my hormone levels. But Andrew, he's a badass dude. Mm-hmm. I think that helps get that out there. And then people like yourselves doing it to where you're not just going to a hormone clinic that's only going to look at the hormone side. You're going to look at the whole scope, which is what, for me, is what I'm picking up on that I like, is it's not, yeah, we could fix this with this hormone. Well, but what about, about some of this other stuff? Because I feel there's a lot of those out there that are just, here's your shot, let's get you jacked, and it's like, well, what about all these other...
Right. So one of the best things for us, and this is a prime example about what you're talking about, the system in healthcare doesn't function effectively any longer. We are both products of those old traditional systems. But what we saw happening and what we were determined and very intentional to change is that time and advice. In traditional systems, we don't build that time in, and we don't allow healthcare providers to spend that kind of time.
Oh, no.
Because everything is monetized, and when everything becomes monetized and a third party is paying for it, suddenly then everything gets down literally to a minute. And all of these things that you've talked about, that take focus away from you when you're in an exam room are not important for us. Knowing what your historical medical background is, what your allergies, your medicines, and those things are much more important than knowing what your insurance pays for and what they don't pay for.
Well, and just your diet too. Like, I've went in with different things. When I had the first staph infection, I went in to see Kristen, and she's like, because I thought I got a spider bite. I was mountain biking, I was doing 75 hard. Yeah. In the best shape of my life, and I was covered with red blood. I mean, it was getting bad, and I was like, man, I called Chris. I'm like, I think I got a spider bite. She was my primary at the time. I'm like, I need to come in, see you. And when I got in there, she's like, oh, Jesus, Matt. She literally this whole leg was red. She's like, if you were not doing 75 hard, and I know that when you say that you don't eat junk food, you're telling the truth. She goes, it's not like a lot of the, some people are going to fib to you. She goes, you would probably be in the hospital right now. But the fact that we did discuss my diet, no alcohol, only water. I think I did like 9 miles of my mountain bike that day before I finally was like, all right, I am just not getting, I'm going to get checked out. Like, before I was looking at all of it, I knew it was a spider bite. She's like, oh my gosh, you're covered in staph, stupid. I'm like, oh, that's a first. Okay. Yeah. But because diet was, I've never had a regular doctor though. What's your diet like? Because they don't want to know. Here's these pills. Take them. Oh, you got side effects? Take these pills.
I think what you alluded to earlier, and when you said it, I think that you don't like traditional doctors. You don't like a lot of doctors. I think what that's saying, too, is that we don't trust each other.
No,
the patient doesn't trust the provider. Yep. And it's unfortunately, the provider doesn't trust the patient. And you can't build that relationship in a 5-minute period of time. No. And so when someone like yourself that knows your body the way you do, and then you come in and say to the provider, hey, listen, I know this is what I need. The provider wants to believe you, but doesn't know you well enough to believe that. And then vice versa.
Makes a lot of sense,
You don't have that trust in them. And so that's the relationship that we want to develop. That is that trust and that rapport, so that we can get away from this belief where we're afraid of doctors or don't like doctors. I don't want to go. They're just going to push pills. They're going to push surgery. Let's build a relationship where we can talk about all the options and not where it's forced on the patient because, well, your insurance says this. I need to check this box and you need to do this. It is, okay, here's the whole picture. Like you said, in the perfect example of the staph infection, like you had some good rapport, the way that you spoke about her. So she was able to listen, like, no, this is what's going on. Like, and you believed her because you trusted her, right?
Yes.
If that would have been a 5-minute encounter, there's a lot more hesitancy around that. So that's really the relationship-driven healthcare that we're going towards. And I think that's what's needed. And that's what Doug said. The time and advice are lost. The relationship has been lost.
Well, and that's the thing. Everybody's relationships have been lost because everybody has seen what a you sit in a room forever, doctor comes in, yep, all right, take these pills, and they go. And then you see a $5,000 bill roll across your insurance or whatnot, and everybody's going, whoa, what the hell? Like, these guys are churning them through the system. But I had someone recently, kind of broke that down for me on like why that is done that way. And it's the system's broken. And that relationship building is so important to, what are you doing? Like myself, I teach martial arts. I still actively compete. I do all these things, but I also eat very healthy. I don't drink alcohol. I don't smoke weed. I don't pretty straight edge on all that stuff. So like I was on ADHD medication. I called the counselor or doctor, whatever they are, was kind of walking them through it. I said, I want a lower dose. And she goes, what? She goes, nobody ever calls for a lower dose. I was like, well, I've done this. I don't do red dye. I don't do this. I don't eat this. I don't. And she's like, that is what I want to hear. I want everybody to call him that. But we talked for like 45 minutes and I know she went way over her allotted time because these Zoom calls now, man, they want to bang it in like 10 minutes tops.
That's it. Right.
We talked forever about it. She's like, I don't even need to see you again I don't need to talk to you for 6 months to a year. Now, they make me talk to her every 6 months. She's like, you're doing what you need to do, and you're the only person that ever said, just give me the lowest dose. Yeah. I just need that little edge. I don't need, because she bumped me up, and I took like 2 days of it. I'm like, oh, wow, this is what meth addicts feel like. Holy shit, I'm good. Take me off. But having that relationship to where her and I can talk, she knows that I'm doing all those other things.
I am Julie Forster with Crafty Midwestern Mommy, your local boutique embroidery and fabric store. I sell fabric as well as sewing notions and also teach classes. And then we also, on the other side of our business, do machine embroidery, custom apparel for local businesses and just personalized gifts. Again, the store's name is Crafty Midwestern Mommy, and that's how you can find us on all social media platforms as well as our website.
Yeah, asking the holistic approach, actually asking about diet and exercise and lifestyle. Most traditional, first off, they don't understand it because we're not taught it well in med school. Yeah. Your point of Huberman, people like Peter Attia and Andrew Huberman, those are the people out there that are helping influence providers and to learn more about truly lifestyle stuff that you don't learn in medical school. And you do have to do your own training, your own research, your own looking at it to really fully understand it. And you've got to have the time with a patient to be able to actually ask them questions and dig into it deeper because it's a vital part. It's an unfortunate part of medicine that, and it's not covered by insurance and it's not reimbursed. And so they don't do it and they don't know how to do it.
Well, at my martial arts school, I get people all the time, well, I'm having trouble with this and the doctor says to do that and blah, blah, blah. And there's some of them, and I'm getting better at this. I've realized I got to do it, have these awkward conversations, but I'll ask them, well, they talk to you about your weight? And I'll have people go, no, but, and I'm like, carrying around about 75 extra pounds that, if you were to lean out, would probably alleviate a lot of that. I've been working with one of my parents at the school, started training with us to get closer to the sun, and he's down over 60 plus pounds. And they told him he was diabetic. He's down 6 plus pounds. He's not diabetic. Dude is happy, smiling. I've been talking to him about, I'm like, all right, have you looked into the hormone stuff? Because you're at that age where because he's a little younger than me. I'm like, you need to check this stuff out. I'm telling you, if you go in and really get things looked at, you're going to be blown away with your quality of life. And I got to tell him, I'm not a doctor. I don't know. I just know what I've done and what made me feel better. And I was like, you're doing all this other stuff, but you're super sore all the time. TRT, you're not going to be that sore. That stuff really helps. Yeah. That was to sleep and recovery.
So the top three that we see, sleep and recovery, right? Mm-hmm. Recovery from the gym, fatigue. The people are just exhausted, right? And it's different than just, I've got kids and a job and family. It's like, I am extremely fatigued and it doesn't make sense. I need a nap in the afternoon.
Yes.
Right? And then that last part that we see that I hear a ton is the cognitive side. So the mood, whether it is increased anxiety or stress or it's brain fog, those three things are what patients are coming through the door. And, even when patients come to us with knee pain and back pain, if they are overweight and you don't address that, and which we do,
you're missing the boat.
You're missing the time. That optimization of weight helps the hormones, which helps the recovery. So it's going to get so much more out of your management of that, say, knee issue. Yes. And looking at, say, alternative or non-surgical approaches, when we utilize PRP and even cellular therapies, we need that immune system to support to the best of its abilities. Yeah. And that's what you're really talking about, that joint pain, that inflammation, that recovery is that diminished and weakened immune system. And we need to encourage more of that immune system to work. And so that whole trifecta there, right? The weight management, the hormone optimization, and then actually treating the symptom or the issue, you have to do all of those to get the patients better.
Yeah, and see, it was weird for me. So I started going to a place for TRT down off Manchester years ago. And was problems.
Hey, we got a really close place that's good. That would
well,
take
no,
good
I
care
don't
of you.
go there anymore, but I went, this is like 7 years ago. Yeah, something like that. And it was funny because I was having issues. My primary care physician couldn't figure out, all of a sudden developed high blood pressure. Couldn't figure it out. I was actually at the fights. I was cornering a guy with my kickboxing coach. Kane and I were talking, and he's a medic. And I was telling him some different things. And he goes, "Are you on an AI? I guess androsol. Am I saying that right? Inhibitor." At the time, I know that.
Anastrozole.
Anastrozole. Yeah.
Anastrozole.
Yeah.
So the
And,
aromatase inhibitor is what you're talking about.
Okay, and I was like, "No." He goes, "Oh, I bet your red blood cells are high." All this other stuff. Sure enough.
Yeah.
That was exactly it. I was skyrocketed because they had been giving me the doses were just wrong. Everything, the whole process was really messed up. Because I just pick up a dose every month and that was it. Never did blood work, never did nothing. Every once in a while they do my blood work, but it depended on what my diet was like. If I was getting ready for a match, like back then, if I was getting ready for a fight, my test to be through the roof because my diet was so clean. There was none of that follow up. There was none of that checking it over. And here I was having problems. Felt like crap. Ends up I think my estrogen was super high. I think it was a 60. No, it was higher than they wanted it when I finally got blood work done after that. But it was just because what I'm kind of getting at is just because these places are saying they do TRT or they do this stuff doesn't mean they're doing it right. Correct. That's what I like about what you guys are saying is you're looking at the whole scale. You're not just bringing this in going, oh yeah, you know what would make you feel better? If I give you this much testosterone too, you're gonna be jacked, you're gonna feel better. Well, what else is probably going on there? Like, what other conversations are we having?
So you bring up a great point, and the intentionality that we bring to the table is we're going to do this with true medical management. We're going to do lab work on you to establish your candidacy and the safety for treating you with these kinds of medications. But we don't stop there. 4 to 6 weeks after we initiate treatment, we're doing follow-up labs. And in our clinic system, we include those in our costs because it's important enough to us to know that you're being managed correctly. Yeah. And man, that's the simple difference. You can make medical treatment absolutely monetized, and you can make it such that, it's totally related to the fees. Yeah. That's not what we're interested in. We're interested in seeing people get better because what we do, every single service is interrelated. So we just had this conversation about the benefits of hormone optimization. And we call it hormone optimization, all right? Because we're trying to find those optimal ranges where patients feel the best, function the best, have the best recovery. But in the context of managing hormones, you also start to manage patients' weight. Now, that doesn't happen in the first few months. No. It's 8 to 12 months when the lean muscle mass starts to occur. Yeah. But in patients who are also trying to lose weight, if you ultimately end up using a GLP medication with them, they have better outcomes and they have better quality of weight loss when you're also managing hormones appropriately. Yeah. Now, we don't manage everybody together. We do what's best for the patient and what's the least
there's no
risk for the
straight
patient.
line of everybody gets this.
Because your body is very different than mine and very different than someone else's. So you have to take into account those individual factors when you're customizing medicine, and that's what we do really good at.
Well, and see, that's amazing. That's really good to hear because and a lot of guys are I feel think this too, that if they take TRT or they do hormone optimization, that's it. And it's like, oh no, you still have to follow the diet. Like, because when I first started researching it years ago, everything was, oh, you're gonna put on 20 pounds of muscle, you're gonna do this, that. I had seen it. Like, I carry more lean muscle. I'm able to stay a little bit leaner, but I also feel better, so I do work out more. So I can't say that if I just did that, I would just do all those things. And I try to explain that to people, like, it's just going to help you do more things, but you're not going to just get it like, holy crap, I just dropped like 15 pounds this week. No, that's not what, or TRT, for example, it's not. I feel there's a big misconception of you're just going to be jacked. It's like, well, no. Those dudes that are jacked and I are still going to the gym and following a high-protein diet. Like, there's things going on.
So, and what you're talking about too is even in the realm of there's androgen and then there's anabolic, right? And testosterone is more androgenic and a little less anabolic. Right. It has a little bit of that factor, so you can gain a little bit of muscle, but you still have to put in the work. A lot of those guys that you see that are very big, there's some anabolics that are associated with that. That's really where that mass comes from.
Right.
Yes,
Right.
androlone, all the anavars, all the big stuff, which again, we don't prescribe that. That's not how our clinic's designed. But at the same time, you have to understand that this hormone has a lot of effects. And to your point, you've got to manage those effects with people. And some of them are very positive effects. Some of them are less positive. And so you've got to be able to watch it, monitor it, have that conversation. And especially in what you said, with so much bad information out there about hormones, there's fears out there. There's a lot of unknowns, especially when you're talking with women, testosterone, estrogen, progesterone, and the balancing of those hormones. You have to do things in a way because you can do harm. Like, I'm not saying hormones by themselves are that necessarily harmful. It's the providers that are implementing them can do it in a way that can become harmful. So we do it in a way where we really balance that efficacy, where we want them to feel better, whatever that better is for them. And then we want to watch their labs and monitor the health to know that we are doing as much positive for them with the least amount to hopefully zero side effects in the whole process. And it can be done, and it can be done very safely, but you've got to be able to spend time with them. You've got to be able to build that trust and rapport with people in order for them to talk and to make it something that's beneficial for everybody.
Well, and everybody's goal is going to be different. That's a struggle I've been having in the martial arts. So I have all these people come in. I'll have parents sign up a couple kids. Well, everybody's scheduled to come in 20 minutes early. They normally come in about 20 seconds early. And so I'm out on the mats coordinating it. I've got my staff and stuff, but I don't have a office to take them in, sit down, have a 45-minute conversation on their goals, their wants, their dreams of martial arts. Most people don't stick with it long enough for me to even have that conversation. So when people sign up, 6 weeks later, baseball comes out, they go to it, or they go to soccer, whatever it is. We have a lot of people that stay, but you still get those. And that's something that I've been working on with like worksheets and different things to give the parents, find out what their goal is. What is your goal coming here with your kid? Our big thing is leadership, confidence, all these things that we teach, and using martial arts as a tool to bring that out in them. Well, do you want your kid to be a pro fighter one day? Because I'm not the place. I got adults that walk in, they're like, man, I want to do it. I'm not your guy. I've coached a couple people. That's not where my interest is. I like to watch UFC as a fun thing. I'm not that talented. I'm not that guy, but I'm good with taking teens and kids and teaching them confidence. So I try to find that out. And so that's what sounds so important about what you guys are doing is you're able to sit down and find out what's your goal. What are you doing? And I would think like genetics has a play in it too, because if there's stuff that runs in the family, that's going to be very important into
Absolutely.
Your diagnosis, correct?
Yeah. Genetics always play a role in it. Oftentimes when we're treating patients for weight loss or for hormones, we see that they have elevated lipid levels too. And fortunately, we can manage that within that scope of treatment as well. And it shocks people sometimes how much their lipids will improve without having to take statin drugs. But yeah, you have to pay attention to it. And these are, patients' goals and aspirations are important. It's what motivates them and it's what drives them. So if we can come alongside them and help them achieve those goals with true medical, rational advice, not aimed at just simply taking their credit card every month, but actually managing them and talking to them and having a relationship, you can get so much more achieved.
Oh, I would think so. It's common sense.
Yeah.
Like you could get so much more than the typical medical system.
And it is about the relationship, man. Mm-hmm. That's the part that we love the most because it's the way that we've always operated. When I started in 1998, I started in Lincoln County, and I had a wonderful old surgeon that took care of 75% of the community and probably delivered more than 30,000 people that came from Lincoln County. His name was Don Mogerman, and he was a wonderful, wonderful mentor for me, but he taught me the art side of practicing in healthcare. And that is to take care of your patients, to know your patients, to have a relationship with them. Because when something serious happens in their life, if you know how they react and what they need, you can be so much more responsive for people. And that relationship is invaluable. So that's why we like practicing this way and having those relationships. That meant more to me than anything in Lincoln County. And I was there from 98 to 2015 and still have a lot of friends and former patients that we've taken care of that are now coming down to Lake St. Louis to see us too. So we're really appreciative of those kinds of relationships. And Devin had a lot at BJC where he was at before. We're very fortunate to have that kind of perspective.
Well, it seems to be such an important thing too. And in today's society with Amazon and everything else and fast food, You don't have that. And that was a struggle. Like as I scaled my painting company, I would run into people like, hey, you painted my house. No clue who they were. My office manager took care of them. My sales manager bid them. My guys painted them. My name was on everything, but I had no clue. And it was one of those things that I decided to kind of scroll back a little bit because I didn't like that. I didn't like it at all. I'd go in to meet customers and not have, I didn't even like really running a lot of Google ads where I wasn't coming in off a referral because I built all my businesses relationship based off meeting people, knowing people. You know, when I walk in there, I walked in to look at one today and Ashley, the real estate agent, I've worked with Ashley for 6 years now, had told them all about me. Like they were just like, sure, what do we need to do? There was trust built. I was able to walk up through, listen, these rooms have lower lighting, so we don't need to roll out the whole room. We could probably get away with touching it up. They're selling the house. I was like, with this main room here, you could see every blemish. We need to roll it. And they're like, great, sounds good. I like that type of doing business, but I also understood that I couldn't be the guy painting it too. And
Right.
there had to be a fine line. But I feel in our society, that's what so much stuff is going to, where it's just, well, it's coming back to relationships because I think so many of us are sick of the, Amazon.com. But like I hate the fact if I want clothes, I cannot go. I always was able to go to the mall, go shopping. The stores that I went to, I knew the people that worked there. It was funny at one of them, I had been going in there for years. I always talked to the manager, always told him. He took care of me, he took my girlfriend at the time. We were younger. And I was at a family event and my great aunt was talking. I'm like, wait, he's my cousin. We just had been out since we were like 5 and just had absolutely no clue. I went straight up there and because she called his mom, who was my cousin, but we just didn't hang out much. It was just a different side of the family. And we were both floored. We had no clue, but we had always, we just hadn't hung out in years, but we had such a great relationship. It was super cool. We're like, oh, no wonder we get along so good. We're family. And we started remembering Christmases, different things like when we were like 5. We were 20 years old now. Mm-hmm. I like having that relationship with people. I talk about it in my book. My book actually comes out tomorrow, and it's going into the gas station, knowing the people at the gas station by your house. Building your business through actually talking to people about your business. Yeah. It's such, everybody wants to run an Instagram or land the next viral TikTok. You're not able to actually engage with your clientele and build that relationship with them. That's what's so cool about what you guys are doing. The whole thing, everything. It's not just a hormone clinic that you're walking in and you guys are going, trying to figure out how much TRT to shoot them up with so their muscles get bigger. Like it's actual practical care too, where you're going to look, like you said, the knees. You're going to look at some things, not just say, oh yeah, give you this.
Exactly.
Now, what type of cool stuff have you guys seen? Because peptides have kind of come on the scene here last couple of years, I guess, have kind of gotten big.
Correct.
Again, I think Huberman, that's where I learned about him, was him talking about him. What type of cool stuff? Because I find a lot of people, I engage in this type of content all the time. Like if somebody's on Rogan or Modern Wisdom, any of these big podcasts, like I'm all over it. But I find a lot of people don't. So like, what is a peptide?
So a protein molecule, right? And so it's going to mimic certain other proteins in your body. So the most common one that you've heard about are the GLP-1s, glucagon-like peptide 1. It's an agonist. So semaglutide or Ozempic, right? Or tirzepatide, Mounjaro. Those are some brand names.
Oh, okay.
Wegovy,
I didn't realize those were peptides.
Rybelsus. Yeah, so they're actually peptides. And they've been around, and they started really in the form of like Victoza, which was a diabetic med we used many years ago, but it was a weekly injectable. What's very interesting is it was used, it did okay for A1C, very little, but patients lost a fair amount of weight. The problem was GI intolerance, because if you looked at the dosing, they started out people with such a high dose that they got these significant GI effects. And then over time, they found that, hey, well, we're not using as much because we can't get people to tolerate it. And then there's a medicine that came out called Saxenda, which is the weirdest name ever, but it was the weight loss. It was like the original version of like a semaglutide or Ozempic, but it didn't really take off. Nobody covered it. There was no compounding pharmacies making it. And this was years ago. This was I was in primary care. And then, so then the last few years, they've had these peptides that have came on the market. The GLP-1s became more popular again, the semaglutide back to the kind of the old school one of the newest ones. And it finally got a little bit of insurance coverage and got some approval from the weight loss standpoint, right? And they also figured out that you have to dose people lower. You've got to start at a very low dose. And because if you can get them to the point that they have a little bit of nauseousness and basically less food noise and less desire to snack and eat, they can lose weight and they can tolerate the medicine without getting so sick that they're vomiting and feeling like crap. But that medicine, that affects, essentially can affect gastric emptying. So essentially it can slow that process down, which can often patients, they feel full faster. So that's kind of how it works from a medicine standpoint, and it works with that one works really well. Now, what's cool is the new one, the Mounjaro, and they've got a 3rd generation they're testing. It's a GLP-1 plus a GIP, and so that combination shows greater weight loss and less side effects. And so these are continuing to evolve. But essentially, the world of peptides is much larger than that. The problem is the FDA has put them on this do not use list because they don't feel like they're safe.
And that were like epimorelin, am I saying
There
that
you
right?
go. BBC 157, TB 500.
Yeah.
So
I heard that those you can't get them anymore.
You can't. So people won't compound them because there's a fear around, because there's FDA oversight. There's a lot to it. And so compounding pharmacies are very hesitant to produce them. Patients can buy this stuff online. Yeah. However, you can't trust the safety of it. You can't trust the use of it. So we don't use it with patients.
Ben Greenfield, I think he's got health. He talks about that you got to, you really got to watch where you get it from.
You've got to find a good source. You got to find a safe source. So the peptides, it's a whole realm. They're a lot of analogs, and they will mimic things like GnRH and HGH, and you'll get your follicle stimulating. So they're mimicking certain hormones and activations in our body to improve production of whatever, right? There's multiple things, but really the only ones now that are, the best ones are marketed that you can get access to are what we said, the semaglutides, the terzepatides, and then you've got this thing called PT141, I'm going to say it wrong, bremelanotide. It's essentially a hormone. There is a drug version of it. And so it's used for sexual hypodysfunction. So for patients with low sexual desire, it can be used. And so it's like an oxytocin really is what's trying to encourage more of that. That's a one that's on there. And there's a couple more, like Samorelin, which is more of the HGH secreting dog. So it's becoming more and more popular. Now, what needs to happen is there needs to be an actual drug form of it in order for a compounding pharmacy to make their version of it. And that's the game that's happening right now, that more and more pharmaceutical companies are creating this and creating a drug version. And then if it is on the a list, what am I trying to say? Shortage list. Yep. So if it's on the FDA shortage list, then a compounding pharmacy can make that same drug with a little twist. So typically they'll add like a little B12, to the semaglutide, or they'll add something to it. To make it so it's their own version. It's not the exact same as a drug, but essentially it is the exact same generic form. And it's very safe. What's nice is there's compounding pharmacies that do a very good job, and they send it to the patient, right? We prescribe it just like a medication. So we can feel confident that they're getting something that is the same quality as if I would prescribe them a blood pressure pill that they would pick up at Walgreens.
Right.
And these are typically injectable forms. So that's the other component of it, which can be a rate limiting step for some people. But these sub-Q injections can go systemic. And what's really nice is you really pass that GI tract, you pass that first pass metabolism, liver effects. They're absorbed systemically so well that people mostly can tolerate them, and then they get really good benefit from them. We're learning more and more from a study standpoint about where that efficacy is. And that's where some of the new ones, the TB500 and the BPC 157, there's a lot of excitement around those, but we just don't know enough yet, right? There's some.
Well, it's come on so fast.
It has.
It's come on so fast. It got extremely popular with a lot of these people that have a large platform that, get into it or whatever. I know if I see, two names that are really big on, if Huberman's on Rogan's podcast, I'm on it. I'm like, ooh, what cool stuff's he got for it? Because like he talks about a sleep protocol, things he takes to help him sleep. I was like, boom, on it. Man, it was great. But, when that knowledge gets out there faster than we've ever seen before.
Yes, that's true.
A good book. I was just telling Joey about it before he came on. Gary Vee's new book is amazing.
Yeah.
His new book is awesome. He talks about that, how like something can happen 20 minutes later, it's out. It's viral. Everybody knows about it. Well, somebody may have just found out about this last week. There's no research stuff behind it. Boom. Now all of a sudden everybody knows. It's a crazy time we live in with this. To where there's also, like when I tell people I've taken, TRT, people are like, really? Like, really? I'm like, yeah, no, it doesn't. The dude that has just got like traps on top of traps, like,
they can't turn
probably sweetening that just a little bit. Like, yeah. But I tell them like, yeah, it's not, because you'll see some people like 80 years old, 8-pack abs, or was like, oh yeah, just optimize my hormone levels.
No.
Bullshit.
Absolutely.
Yeah. No, he didn't. But that's the thing though. I've had so many people that look at me like, really? And they kind of cock their head. I'm like, yeah, it's great for sleep, just everything in general, recovery. When I do fight camp, like it's been huge for me.
Mm-hmm.
But they think they're going to be Arnold, and it's like, oh no, there's even the guys that look like Arnold put in a lot of work. Like don't think dudes are hitting steroids and then chilling on the couch eating candy bars. It's not. They're lifting.
And genetics, to your point, too.
Yes.
Those dudes are freaks, because there's so many guys that work that hard that don't look that way.
Yes. Yeah.
They're still the outlier genetically, plus they put in all the hard work and all of the extracurriculars on top of
the extracurriculars, for sure. Yeah. It was
bonus.
funny, about a year ago, I was talking to a friend of mine. We used to go to a gym after we would get out of school, and it was the first time I'd ever lifted weights. My Taekwondo coach went, no, we never talked about health or nutrition. And so I'm real big on it with my students now, like watching their weight. We've had a bunch of weight loss success with them. And I remember going to the gym, and I didn't think nothing of it. First time going, I saw that was a gym. I was looking back on it, I'm like, wow, those dudes that played, they were slinging roids out of there. Like, I started tagging stuff together. And I was like, text Pat, I'm like, hey, that gym was pretty messed up. He's like, oh yeah, bro. Cause he was, I guess he caught on to it. I was just, whatever. I had no clue. I didn't know nothing. I just remember looking back on it, because there was just a bunch of just huge dudes, and they always had their forearm covered up with something. And I was like, okay, because I think it was when I watched the movie Pain and Gain or one of those. I was like, damn, that looks like that gym I used to go to.
Yeah.
I was like, oh, okay, now I get it. But I feel like that's a big thing. Or my wife did a low dose of testosterone.
Okay. Yep.
Yes. Huge. Sleep, energy, mood, sex drive, the whole thing.
You read my mind.
But when she tells people, they're like, oh, like she's gonna grow a penis or have a goatee,
right?
And it's like, no, it's a very low dose. It took a lot of convincing to get her to do it, and she didn't think it made that big of a difference. The last round, because she did a seed. I think it was a seed, 2 seeds maybe. The appointment went late. We screwed up our schedule and we didn't get in time. And she was like, holy crap, this makes it. Boom. Got her. And night and day. But the trick is she was going to a chiropractor for a thyroid, get stuff, great doctor, but then she was doing the test over. It's like, it needs everything. Yeah. That's what I loved about what you said. Everything's in one place. You can look at the whole scope of it. It just makes a lot of sense.
And let me just make it clear, because we've had a great conversation about hormone optimization. That's number one, not the only thing we do, but we also do not manage anabolics, nor do we manage test levels excessively high. That's not healthy either. So, we just want to make it clear to people, we do this the right way.
Yes.
We establish what your values should be, and we get you to that point by obsessing, in some cases, yes, on your lab values and making sure that they get where they need to be safe and effective both. Males and females both have testosterone and estrogen in our bodies. Females have a preponderance of estrogen in their bodies, and it drives the reproductive cycles in females. In males, it doesn't play that significant of a role, but testosterone plays more of a role. But we need both bodies, male and female, need testosterone to help with the recovery and the building of more muscle, strong muscle, appropriate muscle. But it also helps with stress and dealing with stress. I can't tell you the number of patients who have come into us. We get them on an optimized range, and they come back and they go, besides having more energy, I just handle stress in my everyday life better. And that was one of the most shocking things for me to hear from patients and experience it in my own personal journey as well. And what people don't understand is that stress can play a significant role in affecting your health adversely.
Yeah.
So dealing with it in a multitude of ways, whether it's reducing where your stress comes from, seeing a therapist, or looking at your hormones and balancing them as well, are all important things to do.
Oh, for sure. Well, and if your hormones are optimized, you're feeling better. Maybe there's a diet issue. Maybe there's something that they should be. And then, so maybe you get your hormones optimized. You're talking with you guys, discussing diet, what they're supposed to be doing. Maybe, maybe they need to drop 25 pounds. Well, now they're feeling better. Well, yeah, I'll go to the gym. I don't feel bad. I'm not that tired today. And it becomes this overall effect that I don't think people always put together. Like my life recently, I've got all this different stuff going on. I was like, I'm losing my mind.
Yeah.
So I doubled down on my ice baths. I made sure that I go to the gym every single day. No ifs, ands, or buts about it. I don't care if the guy's calling the van's on fire. Guess what? It'll smolder out before I get there.
Yeah.
Because I'm going to finish my workout. I've doubled down that, cleaned my diet up. I just had to get real strict on it. And the amount of within a week, how much better I felt. And I feel like when people optimize that, when they come to people like yourselves and they start working on that level, then the other things can fall into place.
Correct.
Like I know people that have talked to me because I always post a video of me doing my ice bath all the time. Hey, does that fix this? Yeah, it helps with a lot of things, but it doesn't help if you're, it helps me a lot with stress, but I also don't drink. I don't eat fast food. I'm working out regularly. I walk the dogs every night. So yeah, I do get it. It took me a little bit. I've been doing it for over a year and a half now. It makes a big difference, but it's not going to if you're not doing the others. Like so much of it goes hand in hand. And I feel like some people will try stuff and they don't build that relationship with someone like yourselves to talk about. It's where they try one, well, that doesn't work. That's bullshit. That's just marketing. And it's like, well, no. You can't just do this without this. Does that sound right?
So true. So true. And if the expectation is, hey, I'm going to try semaglutide for a month, that's not long enough.
Yeah.
And the same thing with hormone optimization. We see it all the time with patients who have sustained an injury. They've heard about what PRP or cellular medicine can do for the recovery, and they come to see us, sit down and talk with us. And again, the expectation becomes, well, is this just a one and done treatment? And we always have to go time out. Sorry, that whoever gave you that expectation has set the wrong expectation with you. There's only a very few conditions that we can treat with a single PRP injection and have success. And that's typically around the elbows for a lateral or medial epicondylitis, which, my friend, is very common in painters.
Oh, yeah.
So, because it's,
for sure.
Yeah, it's what you're using, your upper extremities for most of the applications of paint. So we deal with those kinds of expectations all the time. And in the regenerative medicine world, there's really nobody in St. Charles County that's more experienced than he and I. We've been doing these types of injections for 10 years. So we know that it generally will take a series of 3 to make a patient successful. But there again, why do we do it? Because it reduces inflammation, it helps patients recover and heal from injury, and then be able to return to some level of functionality. So with reducing weight, the goal is to take pressure off your joints so you have better mobility. With hormone optimization, it's to help you feel better. It's to help you have a faster recovery time. It's to help have a better libido.
Yeah.
Those are all aspects of quality of life issues. Yes. So that's why we circle a patient with those types of treatment modalities. Now, if they need them, great. If they don't need all of them, okay, that's fine too. We're going to customize that treatment to what a patient needs. And the other facet to this is that we don't take insurance for anything that we do. And that's something we haven't discussed. And the primary reason we don't is because of the undue influence that they exert.
Yeah, I've heard that gets really sticky with them. Like when you get into that, they want to control it.
And you have to justify every single thing that you recommend to a patient. And in some cases, that's simply trying to prescribe a simple medication for a thyroid or a blood pressure medicine. A lot of folks who aren't in our business don't understand the number of telephone calls that we get back from pharmacies telling us that the insurance company won't pay for that medicine.
I bet it's huge.
And sometimes it's generic medicine.
One doctor and a whole office full of staff because they're calling the phones right now.
Absolutely. It's ridiculous. So the hoops that the insurance companies make you jump through sometimes are not for the benefit of the patient. And unfortunately, sometimes patients don't see that because they don't ever experience that kind of connection with their insurance company. But we have to deal with the aftermath of that.
Well, I know just being a contractor, I won't deal with insurance. Like if customers call, they're having this, I'm like, nah, it's cool, I'm good. Like if you want to write me a check and you want to fight with them, go for it.
Right.
I won't do it. And I know different people, oh man, you're leaving a lot of money on the table. I'm like, no, I'm leaving a lot of headaches on the table, bro. Right.
There you go.
Interested. We had someone reach out, hey, do you want to do finance? No. If you can pay to have your house painted, I will gladly paint it. But I'm not doing the other side of it.
Yeah.
And I can only imagine with just I know how complicated they want you to write a scope for a repaint. I can't even imagine. Not only so from a business owner standpoint, like when I've looked at doctor's office, I always thought it was before talking to people like yourself. Because I had someone else on a while back that broke it down like this with the insurance stuff too. I had always looked at it and went, wow, it's really interesting how you have one doctor you got your person checking them in, but you've got all this staff. It's like they are not just dealing with the patients. Like you could have 2 people in the office checking in patient, like that business model. I'm like, wow, that has really got to be a jacked business model that you have to have that many people and that there's such a high demand for coding and billing just to basically fight the insurance to get it paid. And I know how many times I've been sent a bill from a doctor and I'm like, well, we got insurance. What are you doing? And they're like, oh, okay. It's like, oh, you're just hoping I'd pay it. Okay, cool. I see what you're doing. No, run it back through. It seems like such a broken model.
It's completely broken and fractured at that too. So here's the experience from our perspective. It would cost our practice, and we're a small practice, about $150,000 a year to hire 2.5 FTEs for the luxury of being able to bill insurance. Now, tell me if this makes sense in a business model. When you bill insurance, you have to count on not getting paid for 6 months.
Yeah.
How would that work in the painting business?
See, and that's a big argument I've had with people. I do not have a large line of credit. I actually dropped a lot of my contractors because there was a point last year I was owed like $120,000 for several months. It wasn't nothing against contract. I just had a bunch of contractors going. That's all we were doing. It almost cost me everything. And everybody's like, let's get like a $500,000 line of credit. It's like, okay, so borrow money to pay everybody.
Yeah.
And then, because it's very easy for a contractor not to pay a subcontractor. It gets very, very sticky. And to be honest, the law's on their side. It's horribly weighted. Even if I did sue them, I'm going to spend $10,000 suing them for 6.
Absolutely.
It's not worth it. So no, I completely understand that because it's one of the reasons I stopped my growth at one point. Because I was like, I'm not going to put my house up to borrow $300,000 on it to pay everyone every week and hope the builders get around to paying me.
Exactly.
Or that, because I've watched a lot of contractors bid a bunch of work, get a bunch of work going, and then bankruptcy on that LLC. Well, you're done. You ain't getting nothing.
Sure.
Unless you go break their legs. I thought about it a few times. You're not getting anything. And so I get it. That's the other thing I was told is sometimes even if they pay in 6 months, but that's if they pay. They may say, you know what, we don't agree with what you did. You're not getting paid.
There you go. That's exactly what happens.
It's just mind-boggling.
And then you have to pick up that battle and fight that battle, which costs more money. So,
well, that explains why the fees are so much.
A lot of people say to us, well, how are you guys staying in business? Well, the relationship is with you, not your insurance company. So when we can have that kind of contextual relationship, we can give you what you want. We can recommend what you really need and what's important to you. And we can have those conversations. Absolutely not.
Yeah.
So it makes life so much simpler for us and the patient. And a lot of people will say, oh, well, you guys aren't billing, you're not having to expend that $150,000 a year. What are you doing with that? We lower our prices, man.
Yeah.
We went to a lab ourselves and negotiated the price down to the point to where we get a comprehensive lab panel that would cost $1,500 to $2,000 somewhere else for $225.
It's great.
So that's what we do with those savings is we compress our prices down because we want patients to be able to engage us. We like what we do.
Yeah.
And we want to be able to continue to do that. The reality is that, we can't do that for free. Nobody does it for free.
No.
So we want to build a model and have a sustainable business model that also takes care of human beings.
Yeah.
And that's what we love about what we do.
Well, and see, that's what's great. And that's, I feel like so many people want to get rich quick these days that they find different things. They all want the easy way out. They all want the simple fix to their business. On my business, I'll have friends call me, hey man, kind of doing that. Well, have you done the, and you can almost feel like they were like, oh, I thought you just tell me to post a video on Facebook. But that rapport there, that's what at the end of the lifetime is going to get you that recurring business, that slower build.
Yeah.
But that business model makes sense. Like the last time I had this conversation, everybody's breaking everything down. I'm like, wow, it just does not make any sense. I personally wouldn't be able to sleep at night doing that, knowing, being like, oh, we've seen 300 patients this month or whatever. I might not get paid on half of them. Like, I don't even like doing contractor work because of the fact I've had so many, like at the final bill, try to pull some money off, and they do it to every trade. It's not that our quality wasn't good. It's just, it's the way the laws are set up. But when you talk to a lot of longtime contractors, oh yeah, it happens all the time. Huh? Like, hold on. What do you mean it happens all the time? Like, there's a lot of them just have accepted it's the way the business is. For me, it makes me sick. I'm like, there's no way I'm going to do that.
Yeah.
I told my guys, we're going to stay a little smaller, 8 to 10 of us. We're just going to do repaint work, paint now, pay now. 50% up front to schedule, paid. I can get to know them. We're going next week to paint a closet for a customer. Shoot, I painted for Steve for 6 years now. Like, I love that. I went out, looked at a deck for a guy the other day, and I loved it. I was like, man, it's so cool. Come back out. I was like, how's it going? And I was teasing him because when I painted the house 4 years ago, he was working on the deck. And he finally, the other day when he called, my wife goes, hey, you remember Glenn? I was like, ask him if he got that damn deck done. He's like, I'm calling you to stain it. Shut up. It's 4 years later. You know,
But see,
I
you've
love
got that relationship, man.
that. I love that because he even answered, he goes, I don't even know if you guys remember me. I'm like, yeah, I remember you sat in a lawn chair the whole week and watched every move I made. I remember, yeah. And he's a super good guy, but I love that part of it. Like, when people start approaching me, I didn't know. Most people are like, man, you're an idiot. Like, you want to make the big, you think Jeff Bezos knows everyone's use Amazon? I'm not him. I don't want that type of business. I want that relationship.
Us too.
And that's amazing hearing you guys say that, and the fact that you encapsulate all of it. It's not just a one and done thing. You're looking over the whole thing. You're building that relationship, and you're really getting to know your client, you know.
We are. And the other thing that we've done, which seems sometimes counterintuitive to people, but we're going to limit our practice size.
Yeah.
Because there's 2 of us. And we know that we aren't physically capable of...
You can only go so big.
Yeah, we can't take care of thousands of people, but we feel like we can give top bar care to 300 people. And that's what we're shooting for. And we're about halfway there.
That's awesome.
So...
And see, that's smart that you guys see it that way too. When post-COVID was over with, my admission at my Taekwondo school skyrocketed, and everybody's like, man, you got to get bigger location, you got to do this, you got to do that. I'm like, I don't like it. We have 90 students in 44 days, 42 days, something like that. They all dropped out in 3 months. Like, they all just came in off a whim because I ran an ad that just landed really well, and there was nothing else to do because I opened up really soon. Before a lot of places did. I was like, we're open. You want to wear a mask? Wear it. You don't. I don't care. I'm going to clean the school every night like I always do.
Yeah.
I didn't like it. The school was completely overfull. I was overrunning a parking lot, bothering all my neighbors in the plaza because we would take up every spot. Like, the cops would walk by to go to the Honey Badger girls next to us. They'd walk by to eat down there, and they're pointing at me in the glass because they had to park up in the subdivision. I'm like, I'll tell you guys, I didn't like, though, not having that connection, you know, whereas we're at about 150 students. I know everybody's name. I know all the parents. I know if they played soccer that weekend. Like, and you have to walk a fine line because you still have to be a profitable business. But I kind of always fall under that, too. Like, I'm only going to go so high with my student base because I can't actually serve that many people.
Right.
And I don't want multiple. Everybody's like, oh, there's multiple locations. I'm like, nah, I don't want that yet. Like, maybe when my kids are a little older, if they say, Dad, you don't want my own school, cool, that's different. Or like one of my instructors, Riley, she's in college. She's been with me 11 years. If she got out of college, said, you know what, I want a school, boom, let's do it. She's been with me, by then it had been 14 years or something. She'll been with me. Cool, let's open a school. But for me to try to have multiple, no, there's no way. And the fact you guys see that you just want to go to this size, this is what you're wanting, like that's good to hear because in this day and age, everybody's trying to be the next billionaire.
Well, and man, you become part of people's lives.
Yes.
And they become part of yours too. So, you know, that's a nice enough feeling. You want to keep it so that it's manageable. And, you know, the commitment that we make to people is if you join us and have us care for you in our memberships, you have access to us 24/7.
Yeah.
So that is literally your own doctor on call 24/7 that's going to answer the cell phone. If it's not, it's because we're completely unconscious and didn't hear it ring. But we also help patients avoid excessive expenditures at urgent cares. And if you're having to seek your primary care because urgent care is the only place you can go, we positioned ourselves to take care of those kinds of things for our stable of patients. And we do that for $125 a month or $1,500 a year. So we feel like that's a tremendous added benefit. You know, the average American has a deductible somewhere between $6,000 and $12,000, bud.
Yep.
That's huge.
Yeah, we were doing insurance for all my employees, and we finally canned it because they were by the time I paid everything every month, and they went to the doctor and paid everything, and they paid their portion of it because it wasn't 100% paid. Sat down, I'm like, guys, you guys, you know, the economy's not the greatest right now. I did all the math. I was like, here's what you guys are losing.
Yeah.
would you rather have that in your pocket or what? And we got away from it because most of them were like, yeah, I'd rather pay out of pocket.
Yeah.
And they went, shoot, I had 4 employees last week or in the last 2 weeks buy new cars.
Sure.
Like, because they were able to afford that truck they had wanted or something.
Absolutely.
Because we were just, with the money I was spending, providing it on my end with Point, plus what was coming out of their checks, plus it was ridiculous. We sat down, did the math, and was blown away.
And they could get care somewhere else.
Yes,
They could get coverage somewhere else, I
you
should
guys
say.
can get, well, they told me they can get care. You go to the doctor, you go, whatever. I was like, it's just eating up so much of your pay. Or maybe their spouse has access to insurance, maybe, they're a nurse or something to where they don't really need it.
Yeah.
I was like, man, it would just benefit you guys. It was huge because it's such a cost suck. So as we wrap up today, like, where can people find you guys? How is the easiest way to find you and all that?
Yeah, so we're located off Lake St. Louis Boulevard, 64 and Lake St. Louis Boulevard there. You know where the Meadows are at?
Yeah.
We're on the opposite side of the highway there. So there's a new plaza there, and it's being built up, which is nice. We were the 4th building in there. Well, essentially, we were the 2nd to open up, but there's Access Physical Therapy. We're right behind there. So that whole complex at Hawk Ridge Crossing is going to be this huge roundabout, about 16 to 18 of these buildings. And we're right there.
Behind like Walmart and stuff that up there?
No, it's a little, it's before that.
Okay.
Yep. It's closer to the interstate there.
Okay.
But it's going to be a whole complex there. But obviously, DB2Regeneration.com. You can get a hold of us on the website. Obviously, we have Facebook, Instagram, and then, of course, our office phone number, 636-265-2822. Call in. We'll take care of you. You can schedule online as well if that's easier for you. And we'll get you in. We'll take you through a full 1-hour new patient visit. All right. We'll kind of dig into what's going on with you, your situation, and talk about how we can help you and what that might look like for you.
Awesome. I appreciate you guys coming on.
Thank you so much.
Thank you guys for tuning in again, watching this. Make sure you check these gentlemen out, support what they're doing. Obviously, this is amazing. I loved having them on today and learning so much. Thank you guys for supporting the sponsors, and we'll see you next time.